So, John, I guess, do you ever feel like in this approach that you have any restrictions to access to people where you're trying to get their inputs and feedback? You see that as something that is getting easier?
So getting access to people is harder, not easier.
Okay.
Because as I said a little bit earlier, folks are being asked to do more with less, fewer resources. So contention for those resources and contention for mind share is always a challenge. It really is about organizational alignment. And one of my earlier points was making sure that leadership makes time in a day. Don't expect the contributors to find time in their day. They're already out of time. So take something off somebody's plate and show them that it's important enough that you're going to eliminate or reassign work.
Got it. Very helpful.
Welcome to Beyond the Blueprint, a podcast designed to empower healthcare professionals, enabling them to improve care delivery through integrated design and technology innovation. My name is Greg Malkery, and joining me is my co-host, Keith Washington. Whether you're redesigning a hospital, launching a new digital initiative, or just curious about the future of healthcare, then you're in the right place. Let's explore together what's possible when we go beyond the blueprint. I'm pleased to introduce our guest speaker today, John Elms, a seasoned entrepreneur in the area of healthcare communications. John, welcome to our webinar. Would you like to introduce yourself?
Sure. Thanks, Greg. I've been in the healthcare communications space for a lot of years, dating back to my time at Spectraling, beginning in the late 1990s. During that time, I've been driving growth in healthcare communications in many of its forms. And I've held leadership roles at some diverse companies. Along the way, I've been fortunate enough to not only lead trend centers in healthcare IT, but also work with several or many of the disruptive companies in our space. Lately, I've been advising various healthcare providers, industry analysts, and would-be investors in the space in the areas of communications, obviously, telehealth, diagnostic imaging, and RTLS.
Thank you, John. Joining me is my co-host, Keith Washington, a renowned serial entrepreneur and a respected board member at Companions in Courage. Keith, do you have any opening remarks?
Yeah, thanks, Greg. So just to remind our audience of the mission and the vision of Beyond the Blueprint. So it was created to bring design thinking into the conversation, particularly about digital transformation, to empower staff, clinicians to think of ways to improve patient safety, patient engagement, innovation around care team coordination, using design principles. So glad to be here.
Now, before we dive into today's discussion, I want to recognize our valued sponsors who've made Beyond the Blueprint possible, Storage Systems and Simplify Medical. With their support, we're able to bring you insightful conversations around healthcare design and innovation. If you enjoyed today's show, I encourage you to subscribe so you never miss a future episode. During today's webinar, John's going to discuss innovative strategies to advance healthcare communications through digital transformation. He's going to focus on how integration and optimization of communications tools can boost their overall effectiveness. He'll share examples on how to demonstrate how effective communications can improve patient care. And finally, he'll identify some key metrics and KPIs to measure the success of a digital transformation project. So why don't we get started, John? John, how can we design communication systems that are easy for care team members to use and meet healthcare standards requirements, including safety, security, and reliability?
Yeah, Greg, first and foremost, a successful digital transformation, a successful design begins with a user-centered approach to that design. And healthcare enterprises need to honor the importance of designing communication systems with the end user in mind, ensuring simplicity, intuitiveness, and ease of use for both the patients and the providers. Next to the digital transformation projects comes compliance and security. For the purposes of this discussion, I'm going to leave security to the side, as in my experience, all of the healthcare enterprises I've had the good fortune to work with have all had very definite and strong opinions about what security entails for any IT project. What I would say, however, is having deferred on security and on privacy, of course, next on the list is compliance. And I like to think of compliance in the terms of adoption. Compliance by itself sounds to my ears a little schoolmarmish, a little too much oversight and not enough collaboration. So key to making sure that we have good adoption is governance. It's not okay for the project team to cast off into the wind when implementation and go live occur. They need to stay engaged throughout implementation, testing, go live, measuring, and monitoring. Moreover, the executive sponsor needs to convene a team, needs to make sure that those measurements are appropriate to the goals that have been set, that they correlate, that they're clear, that they are transparent, and they're communicated extensively. It is not okay to simply declare success and move on. One must continue to talk about what it is we've done, how's it working, where are there opportunities for improvement or change. And the third step in the project is interoperability. We need to make sure that whatever we do, whatever element we bring into a workflow fits seamlessly with existing workflows. We don't want or need to implement changes that create all new opportunities for nursing education, patient education, provider education, and the like. For example, many applications still require users to log in and to sign themselves to make sure that they're getting the proper notifications and alerts such as they may be. And they don't integrate with existing productivity applications, principally the EHR at this point. So one must really make sure that we're not adding work. The clinicians, the users of these digital IT systems, they want a single source of truth. And that source of truth is generally the electronic health record. Lately, I'm hearing from hospitals that have multiple, and by saying multiple, I mean redundant point solutions, often solving similar problems in different departments. My best advice in this regard is eliminate redundancies, standardize to the fullest extent possible for cost, efficiency, and effectiveness.
Great response, John. Keith, any thoughts on this topic?
Yeah, John, when you get a lot of, so you've got, let's say, the voice of the user, but it doesn't always come back to you in something that you either have control over, or it's something that's competing with something else, and you have to try to figure out, you want to serve the user and serve them well, but there's a practicality to it. Let's say just schedule, cost, other feature functions that you're trying to trade off. I guess, how do you think about that in terms of your approach to getting these teams to participate in this and feel like you say you've got their buy-in, but now you've got their buy-in, you can't necessarily execute on the way they would like you to.
Okay. That's a great question, Keith. I think that in designing the project, selecting the project, if you will, the first step, again, as I said, was survey the rank and file, survey the users, and identify what are the key challenges, the impediments to service delivery, service satisfaction. And the next step is to build a Pareto of what are the highest impact projects that one could tackle. And then there's analysis that has to occur that says, and what's the feasibility? What's the likelihood that we could actually solve this problem? Is it headcount? Is it authorization? Is it budget? Is it interest from the leadership? Can a clear ROI be demonstrated? So what's the problem? What is the order of impact one could achieve by solving those problems? What's the feasibility? And from there, project selection would occur, after which scoping, design, and all that occurs to make sure that the user's voice is truly heard. But there has to be some vetting that occurs up front before one assembles a project team, kicks off a project, only to find that feasibility hasn't been addressed.
Yeah, perfect. Appreciate it.
John, just to cue off your point about user-centric design, a lot of the market research that we've kind of indicates a lot of the top healthcare organizations across the country, they're focusing on user-centric design when deploying clinical communication systems.
Many of them are using agile feedback in order to continuously refine the system based on real end user experiences. This obviously helps improve functionality and drives better engagement and results. Our next question, John, can you describe an example where using clinical communications tools and or alarm management systems improve patient care, quality, and safety?
Sure, Greg. Here's one that I like a lot, and it's not one that I've seen adopted widely. And when I describe it, it will resonate because all of us are very familiar, or I should think that all of us are very familiar with the model that this hospital implemented. So there's a particular hospital. They are located in Eastern Canada. They have nearly 1,000 beds, and they sought to improve their patient transport performance, specifically the measurement of task turnaround time. So this was important to that particular hospital or that particular hospital system because they declared that waiting time is unproductive time. Furthermore, waiting time is a contributor to negative patient satisfaction. I experienced this myself after having been through an orthopedic procedure years ago. After waiting an hour, the nurse said, "To heck with it," a little more colorfully than that. We're going to go do it ourselves. And she packed me into a wheelchair and she pushed me to the elevator, down to the main lobby and out the door. The lesson from that is she waited an hour to get that discharge completed. When she decided to leave the floor, her coworkers had to cover her shift because she was no longer available to her assigned patients. She was frustrated. I was frustrated. My wife was frustrated because she was sitting in the car waiting to collect me and bring me home. And so the solution that hospital implemented, which I thought was brilliant, and it may have actually predated this model, they adopted an Uber model for their patient transporters, or as they call them in Canada, the porters. But the transporters were notified of a need for a transport, any particular equipment that was required to fulfill that need, the location of that need, and the transporter who had the equipment, had the availability, and was in proximity to the service request would accept the call. For the patient, we got improved turnaround time. For the hospital system, they got greater productivity from their nurses. And the employee satisfaction for the transporters themselves was off the charts. One might ask, when you delegate responsibility to the service provider, himself or herself, how do you know the work's going to get done? Well, you manage that by, first of all, establishing goals with the community that's going to adopt the new workflow. What's reasonable? What's a good expectation for patient turnaround time? What I can say is, in this real world example, the hospital enjoyed a 55% improvement in the time to complete tasks within a goal of 15 to 20 minutes. As I said, the important byproduct of this workflow change was the rank and file. Some of the lowest compensated employees in a healthcare system were some of the happiest employees in that healthcare system. That feels like a win for everybody.
Great. Thanks,
Greg,
John.
as we think about tackling a project like this, we need to then think about, how do we implement? What's going to improve our chances of success when we seek to implement a new workflow change? The first one is making sure that executive buy-in is gained before we start. Make sure that leadership says, yes, this is important. We want to do it. And more importantly, that leadership makes time available to the project team to actually do the work, to make the change. This is not about finding time within our work days to get the work done. This is about making sure that we're engaging on a strategic project, that we've aligned the resources to maximize our success in implementing that project, and that we've given those resources the opportunity to be successful. That, to me, in my experience, is key. Making sure that that everybody's bought in. It's not just arm waving and wouldn't it be nice if folks are fully bought in. And the last thing that I want to make sure that we consider when I engage in a project with a team, with a healthcare facility, is making sure that we have a strong feedback loop and make adjustments as a result of that feedback loop. First of all, transparent measurements are important. And I said that earlier, making sure that there is a place where folks can go, call it the break room, the locker room, if folks are changing into their work uniforms, if that's appropriate, but making sure that it's important enough to measure it, monitor it, and publish it. And beyond that, making sure that we celebrate success. Too often we engage in projects, we set lofty goals, and we should aspire to those lofty goals. But the fact of the matter is, when we attain them, nobody wants to celebrate with us. Nobody wants to take us to lunch. If it's your beverage of choice, nobody wants to buy the team a beer to say, "Hey, great work, team. You tackled a big problem and it's made a big difference to us." So measure it, publish it, but more importantly, make sure that you celebrate success.
Thanks, John. Keith, any thoughts on this topic?
Yeah, I mean, that's a very encouraging sort of approach, John. Do you feel like, is that something culturally in health systems, hospital organizations that's growing, having more of that transparency, empowerment, getting the folks that can really do something about it? How do you feel about that, I guess, in terms of a trend? You think we're going in that direction, or is it new, or where are we?
Keith, I'd like to think there was a trend, or there is a trend, and more are moving in that direction. I don't think that's true. And I don't think we could point to community hospitals versus academic medical centers versus ambulatory surgical centers. I really think it comes down to leadership and the ethics, the behaviors that leaders wish to reinforce among their workforce communities. And I don't think you could point to a trend. I think it's a necessity. Everybody in healthcare is doing more with less. Nurses and physicians are burned out. And to the extent we can show empathy, we can invest money to make improvements in those areas. And to the extent we can celebrate success and bring folks together, I think that's just crucial to addressing what we're confronting right now, which is an overworked and tired community of professionals. And those of us who are consumers of those services are only getting older and sicker. And I don't think that bodes well for business as usual. So I'm optimistic that we'll find new ways to do things. There'll be newer, I dare say, younger professionals entering the workforce, and they'll bring with them perhaps some of that youthful enthusiasm and some different ways of doing business. I can hope.
Thank you. Appreciate it. Yeah, that's good input. I appreciate that.
So I like your insights about the Canadian hospitals patient transport rooms. I normally just focus on clinical improvements, but it looks like this is a growing trend of many of the organizations that we've surveyed are now empowering non-clinical workers to help manage their tasks and communications. And I think, as you pointed out, it's actually helping improve efficiency and satisfaction. It's creating a better working environment and also helping enhance patient outcomes. So that's a great validation you just brought up. John, what challenges do healthcare organizations often encounter when introducing new collaboration tools for event notification? And secondly, how can healthcare organizations successfully address these challenges?
Sure. I think the first challenge, and this goes back to some of my early remarks, is identify the key challenges, opportunity areas up front, and get the voice of I say rank and file, but the feet on the street, the feet on the floor. Make sure that you're hearing from those who are tasked with doing the work, what it is that's keeping them from being effective, efficient, satisfying their patients. I think all of us as professionals, as we've grown in our careers, we've received notice from our management, whoever they are, to which we shook our heads and thought to ourselves, or vocalized, they just don't get it. And tops down solutions that evoke, they just don't get it, aren't going to help anyone. Starting out by listening to the voice of the user, the provider, the employee, that's the first one. Some common challenges: resistance to change is a big one. I may not like my job, but what I know is less scary than what I don't know. And I would only say that we've always done it that way, to my ears, is about the most passive aggressive statement that anybody could ever make. Because what that means is, and I don't want to do it differently. And I've already told you that I'm unhappy, I'm tired, I'm burned out. Please help me, but don't change anything. That's kind of a losing proposition. I'm not sure. It surely is a losing proposition. I think also um, the viability of the solution needs to be validated by the project team and then demonstrated to the stakeholders. So we have an idea. We've embarked on a project. Our system designers had given us a proposed solution. The best thing to do would be take that back to the folks who are going to be impacted by that solution and ask, hey, does this feel better? Does this feel like it's going to make a material change in your world and address the challenges that you've articulated? Once that's done and the project kicks off, again, I've said it before, ongoing monitoring, measurement, reporting, check reviews. Are we doing okay? Does this feel like we told you it was going to feel like? The project in Canada really made great use of that. The CFO, and I believe she's also head of patient experience. I need to check my notes. She was the executive sponsor. The director of the facilities department and who oversees patient transport, he was the project sponsor. And then he assembled a team that pulled from his organization to make sure that top to bottom, up and down the organization, everybody was aligned.
Well, Keith, based on some of John's comments, do you have any thoughts?
So, John, I guess, do you ever feel like in this approach that you have any restrictions to access to people where you're trying to get their inputs and feedback, or organizations like you're saying this whole top-down method where everybody hopefully understands why getting inputs? Do you see that as something that is getting easier, or, in your experience, you hope we're moving in that direction as well?
So getting access to people is harder, not easier, because as I said a little bit earlier, folks are being asked to do more with less, fewer resources. So if there's alignment from top to bottom, if the sponsoring executive really puts her money where her mouth is, and the department director really makes it a priority to call project team meetings, attend those project team meetings, even if he or she is not the project manager, but shows up. So for me, it really is about organizational alignment. And one of my earlier points was making sure that leadership makes time in a day. Don't expect the contributors to find time in their day. They're already out of time. So
Right.
take something off somebody's plate and show them that
Right.
it's important enough that you're going to eliminate or reassign work.
Got it. Very helpful.
John, I thought your emphasis on identifying operational challenges early on and engaging stakeholders really resonates with a lot of the work we've done. Projects are more likely to be successful when you can proactively address user concerns and you can integrate their solutions with existing information systems and workflow. I think engaging stakeholders during the planning process and continuously monitoring really does ensure the solution remains relevant. So I thought you had a lot of really great points. John, how can healthcare leaders effectively measure ROI and success for a digital transformation project? And secondly, can you suggest some specific metrics or KPIs for tracking a deployment?
That's a good question, Greg. I think that finding a particular measurement that closely correlates to the result you're trying to achieve um, is really fundamental to the success of the project itself. I said when we spoke about the hospital system in Canada, they used task turnaround time as a measurement that they believe was most easily and accurately measured that would correlate to patient and staff satisfaction, right? So when we think about patient satisfaction, the Press-Ganey scores and others like Press-Ganey have no immediacy. There's nothing there that allows let's say, a nurse manager to attack a problem on his or her floor before it becomes a patient dissatisfaction issue. So the idea that we have closely correlated metrics that the affected user community will embrace and agree correlates closely to a measurement that we're seeking or an outcome that we're seeking to drive. I think that's where success is. So again, at the beginning, what problem are we trying to solve? That's an important one. And how important is that problem to us? And what's the impact of that problem on our operation? Once we get there, how do we measure improvement and how do we do it in a way that it creates an aha moment? Somebody looks at it and goes, well, of course, that means we're going to be better at whatever problem we're trying to solve. Getting that aha moment from the folks who are affected by that workflow change, that digital transformation really is key. So again, task turnaround time. We've all found ourselves drumming our fingers, waiting for something to occur. Knowing that I'm going to measure my turnaround time and I'm going to seek continuous improvement in my turnaround time, that has a cascading effect that everybody just kind of gets. And pushing those goals up front and then testing them with the impacted communities, that's really the key, is making sure that folks get it. They understand what it is we're trying to do and what it's going to mean when we get there at the end of the journey that we're going to.
Great response, John. Hey, Keith, any thoughts on this topic?
No, I think that's a really, really well said. I could have said it better. That's great, John. And I think it goes with transparency as well. You had mentioned that a lot earlier, that if you're going to get to this stage, that's really a key to help and facilitate making that happen.
John, my research shows using specific data-driven KPIs, things like patient satisfaction, as you brought up, or task completion times, actually enhances the project outcomes. And the tracking of real-time or near real-time metrics, ensures that you stay aligned with the organizational goals. Unfortunately, I'm not finding as many organizations that are actually tracking these things, and specifically around communications. You may be tracking the overall care workflow, but I didn't find a lot of organizations actually tracking the communications element of it, as we were talking about communications earlier in discussions. But I think this is aspirational, and I'm encouraged by the opportunity. Well, today, John, I'd like to thank you for sharing your thoughts. You provide us a lot of valuable insights about advancing healthcare communications through digital transformation. We talked about designing with the end user in mind to ensure options work effectively. We discussed how integrating communications tools and implementing change management can help improve care quality and provider efficiency. And we highlighted some key strategies for overcoming operational challenges when deploying these solutions. Our discussion today kind of aligns closely with some of Spyglass's recent market research focused on digital patient engagement and clinical communications. For those of you not aware, Spyglass is a product and go-to-market advisory firm focused on disruptive technologies and growth opportunities within the healthcare and life sciences industries. Spyglass has more than 250 customers who are leading technology companies, management consulting firms, healthcare providers, and investment organizations. We've published more than 30 different market research reports on a variety of different informatics-related topics, including mobile computing, communications, digital engagement, telehealth, and clinical surveillance. To explore Spyglass's extensive library of paid research and to gain deeper insight in how technology is reshaping healthcare, I encourage you to visit my website at www.spyglass-consulting.com. Well, John, thanks again for sharing your time, insights, and perspectives, and to our sponsors, Storage Systems and Simplify Medical, who made this conversation possible. John, would you like to provide us with a couple of closing remarks that you'd like to leave our audience with?
Sure, Greg, I'd be happy to. I start by saying, and I started the conversation, establish as your North Star user-centered input. Make sure it's all about the users. If you're embarking on a digital transformation, prioritize user friendliness, which will drive adoption, making sure we don't do projects twice. I always encourage folks, don't shy away from challenging orthodoxy. We want to strive for greatness, right? I think about Jim Collins, the author of Good to Great, and others, a fellow Boulder, Colorado resident, or at least in my case, part-time resident. Good is the enemy of great. Let's strive for great. Let's not strive for good. As you think about your digital transformations, find siloed point solutions that just stand on their own and don't add value to the greater enterprise. Make sure that whatever you're doing has broader applicability and that department fiefdoms, if you will, aren't buying applications, implementing applications, and driving IT to support applications that don't have a greater good, if you will. Always start with your EHR as the center of your universe, because it is, and establish compelling reasons why you would have an application that could as easily and maybe almost as completely done, as it is in a standalone application. And I think about communications, find ways to enhance what Epic and Oracle Health are doing. Don't seek to replicate it and out application them. Find ways to be relevant. Key ways to be relevant is focus on areas of the hospital that your EHR doesn't touch. I talked earlier today about transport, med gas. There are lots of areas of the hospital dealing with access and sanitary conditions. So it's not just about the EHR. Make sure that whatever you do is not going to be replaced by your EHR in the future. And do stay attentive to where you can add value to that EHR as opposed to compete head to head, because in my estimation, that's not a winning formula.
Great. Thanks, John. Hey, Keith, would you like to share any final thoughts on today's webinar?
Well, I would just like to thank John for his taking the time and for his leadership. And I really took away a few important talking points there. So the user-centered design, but then consistent with the enterprise standards. User-centered design has got to be where everybody's buying into the HR and the overall organizational goals. I think that was terrific. And I think it aligns really well with Beyond the Blueprint in terms of where communication, improving communication by design, those are important ways to go about that. So I really appreciate that, John.
Well, at Beyond the Blueprint, we look forward to continue our conversation with you in future episodes of this series. And hopefully we can invite you back, John, for another informative session. Thank you very much.
Thanks, John.
Hey, thanks, guys.
Thank you for listening to Beyond the Blueprint. Together, we're exploring how thoughtful design can simplify complexity, enhance patient care, and create meaningful change. If you found value in today's episode, make sure to subscribe and leave a review in order to help us continue the conversation. Let's reimagine healthcare together on Beyond the Blueprint.